Sure. So what we wanted to do with this abstract was to validate a composite score that could measure disease activity among patients with PsA in a more simple way that what we have for the clinical trials, because the difference between clinical trials and real life is that most of the time the physicians, they don't have the time to assess all the single joints one by one and to do all the measures that are associated with the composite score that enable us to demonstrate the efficacy of the drugs in the setting of a clinical trial. And so we need desperately to find some composite scores that can be used in clinical trial and validated in clinical trials, but also can be used in clinical practice. And the best way to do that is to look at the bio-naïve first population. And we have two clinical trials, the two phase 3 trials where we included some bio-naïve patients, Discover 1 and Discover 2. And so we pulled together those data, excluding the patients from Discover 1 who had experienced a previous TNF, and those were around 30% of the population, the total population of patients enrolled in Discover 1. But the others from Discover 1 and all the patients in Discover 2 were included in that study. So we had bio-naïve patients treated either with guselkumab 100 milligram at week 0, week 4, and then Q8 weeks, or guselkumab 100 milligram at week 0 and Q4 weeks. So every 4 weeks you receive the dose, or a placebo until week 16, and then there was a shift from placebo to guselkumab along the way. And Discover 1 was a 1-year study. Discover 2 was a 2-year study because we wanted also to assess the radiographic progression in those PsA patients and the effect of guselkumab among bio-naïve patients, and the study was a 2 years duration study. So we pulled those patients with TNF naive, and we took all the components of the cDAPSA to compare the cDAPSA response and the state of low disease activity or remission, which is a score below 13, with patients treated with guselkumab on one side and the patients treated with placebo on the other side. And we looked at the number of patients who were in low disease activity and remission at week 24, but also among those patients who reached the remission at week 52 and week 100, because we had some of them a follow-up of 2 years. And then the second thing that we did, because it's something that is commonly used in composite score when you measure disease activity, you want to know if early response is predicting a reduction in the radiographic progression. So we wanted to see if it was also true with the cDAPSA. And so the patients who were in remission at week 8 with the cDAPSA, we wanted to see if they had a lower radiographic progression than the patients who were not in remission or low disease activity at week 8, and we could demonstrate that as well. So that was the design and the results of the study. So what is really important here is that we demonstrate that using a very simple tool, we can really have a tool that enables the physicians to know what is the level of disease activity in his patients on a daily practice, and that evaluation can predict whether or not the patient will have radiographic progression in the future. So that's really a tool that is easy to use and is associated with a very good understanding on what is the level of the disease activity for the patients. So I think that moving forward, the cDAPSA will become more and more important. And this is why, as the Janssen, we really wanted to look into our data and see if we could help also the scientific community to make progress with this tool, because clearly it will become more and more important also to, if we enter in the era of treat to target, to have tools that enable the physicians to really monitor closely the disease activity of the patients without spending too much time in the clinic looking at the different endpoints. So this is something that is really important for us, is not only to bring new drugs to the patients, but also to help the physicians to better monitor and manage the disease of their patients.